Welcome to the Maternal Wealth Podcast, a space for all things related to maternal health, pregnancy, and beyond. I'm your host, Stephanie Terrio. I am a labor and delivery nurse and a mother to 3 beautiful boys. Each week, we dive into inspiring stories and expert insights to remind us of the power that you hold in childbirth and motherhood. We're here to explore the joys, the challenges, and the complexities of maternal health. Every mother's journey is unique, and every story deserves to be told. Please note that this podcast is for entertainment purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your healthcare provider for medical guidance that is tailored to your specific needs. Are you ready? Let's get into it. I'm proud to introduce to you Dr. Katrina Roundfield. Dr. Katrina Roundfield is a licensed clinical community psychologist who transitioned from academic medicine to entrepreneurship in behavioral health tech startups, driven by a passion for the transformative power of human change. With nearly 2 decades dedicated to creating and implementing interventions that foster healthier outcomes for families and communities, she embodies the belief that we all can make better choices for ourselves and for those around us. Dr. Katrina Roundfield earned her MA and PhD in clinical community psychology at DePaul University, followed by her predoctoral residency at Yale University of Medicine. Afterwards, she completed an NIMH postdoctoral fellowship in clinical services research at the UCF School of Medicine. Dr. Katrina Roundfield was the co-founder and chief clinical officer of APA Health, a teen mentoring and mental health skills company. Katrina was also on the founding team of 2 Chairs, an adult psychotherapy startup. Katrina maintains an advisory role at 2 Chairs today, and under Katrina's executive leadership, the company scaled from 0 to 1,000 therapy sessions a week. Afterwards, Katrina was ready to make change. In this episode, you will discover how a remarkable woman with firsthand experience of matrescence is revolutionizing immediate postpartum mental health care. What barriers do we encounter when seeking help for postpartum depression, anxiety, and rage? Barriers that we face include access, time, empathy. Dr. Katrina Roundfield and her collaborator have co-created an innovative app with Tara that bridges the gap, ensuring women and birthing individuals receive the support that they need to prevent mental health crises during the critical postpartum period. Imagine having help right in the palm of your hand, exactly when you need it. I'll share real examples from my own matrescence journey, including challenging mornings filled with seemingly endless tears. While my husband's at work, my support team is miles away. In those high-tension moments plagued with sleep deprivation, lack of nutrition, loss of identity, the app with Tara provides virtual support. This journey of matrescence shines a light on how we can navigate a path that society often overlooks, guiding us through tough times and helping to prevent crises. I'm excited for you to learn more about Dr. Katrina Roundfield and how her journey through matrescence is now empowering others. Welcome, Katrina.
Hi, Stephanie. Thank you so much for having me.
Thank you so much for being here. I'm so excited to get into the conversation with you, learn more about you and your journey into motherhood and how that brought you to where you are today.
Amazing. I'm excited.
So one of the ways I really like to start the podcast is to have you share with us, with the listeners, about yourself before you became a mom.
Sure. So before I became a mom, that was 7 years ago. Leading up before that, I got my PhD in clinical and community psychology. I planned to be a research professor. And so I started doing research on child and family and mental health. That was really my focus. I ended up going to Yale and then transitioned to be a professor at the University of California, San Francisco, UCSF. And there I was doing research, focusing on the mental health of families. And over some time, just decided that I wanted to bring a lot of my research more into practice. And we're in Silicon Valley, San Francisco area. I met a few people and started working on the side, consulting at digital mental health companies as a consultant. And then eventually decided to make the leap of faith and move into a full-time role as a founding clinical leader at a company called Two Chairs. So I was there as our leading clinical person at the company and built that company for 4 years. Company was doing great. And during that period, actually backing up, a whole 4 years, I was at the company. But in the very first year, in fact, when I was offered the job, I told the founder and CEO, hey, you just offered me a job. I just want you to know I'm actually pregnant right now. And so I let him know that I was pregnant. I asked him, is that going to be a problem? Because we shouldn't go forward if there's going to be some kind of issue with me being pregnant and at a startup. And he was true to his word and supported me every step of the way during my pregnancy and when I came back. But I will pause there because that is the place where all of this starts in terms of my story of where I'm at now, what I'm working on now, and why I'm so focused on postpartum care and the support of mothers for their mental health throughout their journey into motherhood.
So let's get into that.
Sure.
With your journey into the pregnancy, postpartum period, birth, where did you find yourself in that experience that led you to where you are now?
Yeah. So my experience into motherhood was not what I expected. And I think it's really important to note that what I have found is that my story is not unique. It is the story of many women and birthing people that we read all these books, we take all the child prep classes, we try to know what to expect when we are expecting. And it turns out that most of us are not emotionally prepared for the transition into motherhood. And that was my experience. What happened was I had a pretty, not unremarkable pregnancy. It was no problem. It was a really easy pregnancy for the most part. I was very fortunate that I was able to deliver my child actually without medication. That's how I wanted to deliver, really wanted to kind of own my birth story. And I was very fortunate that it all worked out that way for me. However, the moment that I left the hospital and had this beautiful little boy in my arms, my son Miles, I was pretty much gripped with panic and fear and overwhelm and anxiety and all the feelings. And I was not emotionally prepared for that. I thought that I was a pretty resilient person. I thought that I knew what I was getting myself into. And unfortunately, I had the experience of just feeling absolutely terrified for a good portion of my entire first year postpartum. And I think, the deeper I've gone into exploring the mental health and wellness of women, I've realized that this is, again, not a unique story. And it is also something that we are not really prepared for. And our medical system sort of fails us in this period of time where the support is really lacking. So that was a little bit about my experience.
With your postpartum experience, how did you find what you needed to get you through that time?
Yeah. So for me, what ended up happening was I'll share a statistic that on average, women and birthing people get about 700 minutes of pregnancy prenatal care. And that's everything from, gestational diabetes tests to appointments to childbirth prep. All of this happens in pregnancy, 700 minutes. On average, after the baby arrives, moms get about 30 minutes of care. And that was my experience. As you can see, that's a pretty massive gap in care because the medical system sort of thinks, okay, well, the medical emergency, which was you giving birth to a child, is no longer present. And so since the baby is here, you should just be fine. And that is not the case. In fact, 80% of women experience extreme emotional distress in the entire first year postpartum. And that was my experience. However, I did go to a postpartum appointment. That was my 30 minutes. Thankfully, my husband forced me to go. I wasn't actually going to go. And actually, a lot of the research shows that many women miss that appointment because they're so focused on baby. They will not miss a pediatric appointment, but they're very likely to miss a postpartum aftercare visit. Thankfully, I did go, but I was I showed up to the appointment pretty frazzled. I don't even know if I brushed my hair that day. I had the baby with me. I was, not sleeping. I was just worried. And my doctor, being a fantastic doctor, was able to ask me a few questions, gave me a screener, and screened me for anxiety and depression. Interestingly, I did not actually qualify for a disorder. So I had symptoms, but it wasn't high enough to, say that I actually had postpartum depression or anxiety. And as a result of that, my doctor didn't recommend further care. But what she did do was she listened and she was empathetic and she asked me to walk her through my day. I told her, well, I wake up and then I track everything on these trackers and I track the baby's poop and I track the baby's pee and I track the feeding and I track these things and I don't leave the house. And my doctor said, hey, Katrina, you really need to stop tracking everything. It's making you really obsessed and anxious and it's not good for you. You need to leave the house. You need to call a friend. You need to ask somebody to come and help you at the home because my husband had to go back to work, unfortunately, pretty quickly. And so, my doctor had really practical preventative mental health tips for me that were just things I could do, but I needed somebody to tell me to do them. And so I did do those things and I did start to feel a bit better. I then sort of returned back to work after about 3 months. I took only 3 months. And I think in some ways work was helpful to me because it helped me to take all of my obsessive thoughts that I was having that could have turned into postpartum OCD. And I just obsessed about the company and I obsessed about my job. And I think it was actually a healthy shift in how my brain was kind of restructuring and rewiring itself. And I'll talk a little bit about that because a lot of what I focus on now at my company, Tara, is focused on matrescence and how women's brains and bodies change and how that actually has massive impacts on mental health and wellness for women. But I did go back to work. I started to feel a bit better. I will say the whole first year was a bit of a blur, and I feel like there were a lot of days that were unpleasant, anxiety filled, and worrisome for me. So I think that very commonly for other women as well, that whole first year is almost like a survival mode. I think that's a common experience, but I think we're not doing enough as a society to support moms in that experience. And I was, grateful and fortunate to have a doctor who just said, hey, you don't need to worry this much. Stop tracking all these things, like do something different, or you're probably going to end up developing an actual disorder here. And thankfully that intervention happened. But I think so many women and birthing people don't get that intervention and don't have any tools or skills or even just the basic knowledge to understand what's happening with them and their health and wellness.
We paused this episode for a quick message from our sponsor. At Maternal Wealth, we aim to ensure that you have access to the best and the most appropriate care. That's why we created a maternal healthcare provider database. Maternal health providers can easily create profiles to promote their services and business, helping to increase access for those seeking their care. This is a one-of-a-kind database that offers a new and exciting way for women to search for and find maternal health providers near them and tailored to their specific needs. Profiles feature badges that highlight various services such as TOLAC-friendly practices, all-female practices, LGBTQAI+ inclusivity, language options, access to vaginal breech services, and more. Additionally, be sure to check out our Not Your Average Birth course. In this course, I discuss the variations that exist in hospital practices based on policies, staffing, and budgets, all of which can directly affect your birth experience and outcome. So you go back to work after your first child, and then I know you have two. So before you got pregnant with your second child, where did Tara come into play?
Great questions. Tara came into play when basically really it's a fast forward of about 6 years. gave birth to my child in 2018, my first kid, went back to work at Two Chairs, stayed there for 4 years, gave birth to a second child while I was at Two Chairs as well. Had a similar experience with my mental health, not quite as debilitating and difficult as my first, but still very challenging. And then transitioned out of that company, ended up going to another company focused on teen mental health. And during that entire period, I kept thinking about and talking to women, health providers, reflecting on my own clinical practice, working with postpartum moms, and just continuing to think about what would have been better for me? What would have helped me during my postpartum experience and that whole first year after giving birth? And I just didn't have a good answer. An obvious answer, because I'm building mental health and therapy companies, would have been to just provide better therapy to moms. But to be really honest with you, and maybe unexpectedly and a little contradictory given the fact that I am a licensed psychologist, is that I didn't think that therapy was the answer for me. And for me, I think that I had all the resources to go to therapy, but one, my doctor said I wasn't clinically unwell. I just was emotionally struggling. And, therapy is really for clinical issues, at least from my perspective. And then the other piece is that even if I had thought to go to therapy, when was I going to go? I didn't have a lot of time. I had a baby with me, and then I had a second baby. It just felt like I didn't really have the time to do that. And I didn't really know if I even wanted to admit that I would have needed therapy. It just was, so much survival mode, and not focusing on myself was such a huge part of my survival. It was really just focusing on the baby. And so for years, I thought about what could have helped me and what could have helped other moms. And I ended up doing a lot of research. I am a researcher. That's my kind of base level of kind of career, is really understanding research and reading a lot of research and understanding the cutting edge science. And I came across research. Shout out to a friend of mine, Nicole Pensack, Dr. Nikki Pensack. She wrote a book called Rattled. And I read that book, and it was really eye-opening about matrescence, about how the brain changes. I read that book in 2024. Had my child in 2018, thought about this issue for a long time, didn't really see a good answer, and then came across a book that a friend of mine sent me, and she wrote it. And I read it. It's about matrescence. And then I went deep, deep down the rabbit hole, reading all the research I possibly could on this topic, and learned so much about, an information gap. I'd never even heard of the word matrescence before. I'd literally never heard that word before. So, I'm a clinical psychologist educated at Yale and UCSF, and I don't know this word. That feels like something that is pretty much a massive information gap. And as a broader point, I think in maternal mental health and maternal health generally, there's just so much lack of knowledge, lack of information that's shared with women. Critical information that really could save lives, literally could save lives, is not shared with us, because there's not always a focus on women's health. And this is yet another example of that, most women are not educated about the emotional fallout that's going to happen when they give birth to a child. It happens to probably everyone, actually. And, after reading that work and going deep down the rabbit hole, I said, this is it. This is what I want to bring to the world. This is the company I want to build. I want to help women understand this information. I want to give them practical mental health, science-backed tools to support themselves that are really easy to use. And I want to give them a supportive community that is not a crazy Reddit rabbit hole or some strange Facebook mom group that ends up going off the rails. I want to give them a community that's moderated by mental health professionals and actually can, give them a space to grow and support each other together in a moderated, safe space.
So you're a young mom, you have two little kids, and then you start your own company. Talk us through that.
Yes, thank you. Yes. So by 2024, I had decided that I wanted to start this company. So got to it. My kids at the time must have been maybe 4 and 6 or 3 and 5-ish, depending on what month it was. And it's not for the faint of heart to start a company when you have really young children. I have an incredibly supportive husband, and I think husbands are not always appreciated in the way that they should be, but I will say that my husband is absolutely supportive of me. He gives me the time and space and supports me in all of the ways to actually get this done. I also have a lot of flexibility because I'm an entrepreneur, so that allows me to show up to read to the kids at literacy center, or pick my kids up early from school or anything like that. So it's been a blessing. But yeah, it's a little scary to start a company and do that with just from the ground up. But the thing that really motivates me is that it's just so motivating to think about. My passion has always been to help children and families. My entire research when I was younger and as a professor was to support the wellness and better outcomes for children and families. And as it turns out, the biggest predictor of healthy child and family outcomes is whether mom is feeling good, whether mom is, taking care of herself and is finding joy and is enjoying the quality of her motherhood experience. And I think, the most important thing we can do for families is to support women and to support the mothers. And so that is what motivates me. It's my deep passion. And honestly, I think it also makes me a better mom to build this company. And so, that brings out the best in me to be able to make a difference for other moms, but also I'm learning a lot. I actually use the skills that we teach on our platform, and it's helped me with things like mom guilt and mom rage and finding moments of joy. I literally use the skills that I teach. And so it makes me a better mom. And I hope that it makes other moms the moms that they want to be, and be able to show up for their families in the way they want to show up.
How did you come up with the name Tara for your company?
Great question. So I have a phenomenal co-founder who is an engineer, and he really is an entrepreneur who has the technical expertise of being a fantastic engineer. I worked with him at Two Chairs, and then I worked with him at the company that I was at, the teen mental health company. And then, when I transitioned from that teen mental health company, he was the first person to say, "Hey, Katrina, we've been working together for the last 2 companies and 6 or so years. Let's build a company together." And I said, I would love to do that. And so we started working on Tara. And at the time, I actually had a name for it that is cute, but it's just not clever enough, I think. And so I actually was going to call the company Miles Ahead because my son's name is Miles. And, we want to create something that allows moms to be miles ahead. It's just not really catchy in the way that apps are supposed to be catchy, or digital companies are supposed to be a little catchy. So anyways, I shared that with my co-founder, Jesse, and he said, "This is nice, but let's keep thinking about that name." And actually my husband, I told my husband the name, and he was like, "Miles Ahead, it's nice because it's a tribute to Miles, but then what about our other son? How will he feel when he realizes you created a company and didn't name it after him?" And then so it was already riddled with a few flaws, but my co-founder explained our company to his wife, and he explained, "Hey, it's about matrescence. It's about how women's brains and bodies change. And actually biology is really on their side because their brains are changing in a way to essentially learn their baby, show up best for their baby, and, provides a lot of opportunities for women to be the best mom that they can be." And his wife said, "Oh, that's interesting. It kind of makes me think about Tara the goddess." And she is a Buddhist goddess who is thought of as kind of a maternal figure. She's actually thought of as the mother of all Buddhas. And she basically was like, "Maybe you should name your company Tara because it's kind of helping moms be their highest self, their most enlightened maternal self." He said that name, and I was like, "You know what? I think that's the one." I think that actually might be better than Miles Ahead. So let's go with that. And I've really loved that vision that, moms can be their own goddess and they actually have everything that they need to be the best mom they can be. They just need a little bit of support during this really difficult transition.